It's no surprise to anyone that abortion is a sensitive topic in 2023, especially from a medical lens. It should be common knowledge to most adults in the United States that Roe v. Wade was overturned in June of 2022, making it possible for any U.S. state to enact abortion restrictions. Roe v. Wade, a case whose verdict was initially decided in 1973, ruled it unconstitutional to deny the right of an abortion to a pregnant person, citing it as a violation of Amendments 1, 4, 5, 9, and 14 of the Constitution. When overturned in 2022, a slew of states implemented bans and restrictions as quickly as they could, including Indiana and the majority of southern states. After 50 years, why would the Supreme Court go back on its ruling now? Well, it's been controversial across the United States since the initial decision in 1973, particularly opposed by religious groups who have been protesting outside of abortion clinics and college campuses for 5 decades now. It's known that those who oppose the right to abortion call themselves pro-lifers, and those who support the right to abortion call themselves pro-choice. Heated debates between both groups, protests, and public outcry led the Supreme Court to reconsider the right to abortion as a constitutional right. When overturned, the court was quoted to call the initial ruling's arguments exceptionally weak and an abuse of judicial authority. Justice Samuel Alito writes in his 78-page opinion paper that the Constitution does not provide an inherent right to personal autonomy and privacy, and therefore does not support the right to abortions. In the year and change since the court's decision, most states in the United States have more or less settled on whether they will or will not be restricting abortions and what those restrictions entail. In this figure from the New York Times, the states in red have enacted a total ban on all abortions, with Indiana very recently joining their ranks this past August. Georgia and South Carolina have banned all abortions except those that occur within 6 weeks of fertilization. Nebraska and North Carolina have a 12-week ban, and Florida, Utah, and Arizona have a 15 to 18-week ban. However, pulling the Roe v. Wade decision does not mean that states that do continue to allow abortions are unaffected. A CNBC article in January highlighted a lawsuit against the FDA to pull mifepristone from the entire U.S. market. Mifepristone, used in combination with other medications, is the most common way that Americans perform legal abortions. It allows patients to take a course of medications at home to terminate the pregnancy, alleviating the need for any invasive interventions or surgeries. As of November, the case is still ongoing, but mifepristone can still be prescribed in states that allow it. How do abortion restrictions impact public health? From a medical lens, abortions are widely considered to be a necessary medical procedure. There are a lot of reasons that someone might need an abortion. For example, if they are a victim of rape or incest, if a contraceptive has failed, if they do not have the money to provide for a child, if carrying a fetus to term would cause major health complications and risk their or their fetus's life, if life-threatening, debilitating, or chronic conditions run in their family and they would rather not risk passing it down, many other reasons, or a combination of reasons. Legal and regulated abortions in a clinical setting allow these terminations to happen in a clean environment with medical professionals involved to aid in keeping the pregnant person safe. Studies have shown that banning abortions do not significantly deter the number of abortions that happen, but they decrease the number of safe abortions. They cause an increase in terminations that people attempt themselves, usually in unsafe ways that lead to lethal outcomes in many cases. Sharon Cameron with the University of Edinburgh states, tragically, almost half of all abortions that take place in the world are conducted under unsafe conditions, mostly in countries where abortion is illegal or highly restricted. These unsafe abortions are a major cause of maternal death and disability. Professor and reproductive health researcher Tracy Weitz with the University of California states, the only alternative to abortion is childbirth, which has a 14 times higher risk of death than abortion. So in denying a person access to a wanted abortion, states are forcing significant medical risk against their will. She calls out that abortion restrictions will particularly affect Black women, who already experienced the highest rate of maternal mortality prior to 2022. Additionally, research shows that women who have been denied an abortion had lower credit scores, higher debt, increased likelihood of staying in an abusive relationship, and more long-term health complications compared to women who were able to receive an abortion. Restrictions on abortions can have particularly brutal consequences for adolescents, especially in a country with debates surrounding the efficacy of existing sexual education. Researchers with iPass Impact Network show that teenagers make up to 15% of unsafe abortions, and their experiences are more likely to be compounded with sexual abuse, poverty, and mental health issues if they are under the age of 15. Their research also shows that, aside from legal restrictions, many adolescents will opt to try and terminate a pregnancy themselves, as opposed to seeking medical attention due to societal stigma and receiving judgment or hostility from healthcare providers. The threat of facing hostility and abuse when seeking abortion is high. In 2020, the National Abortion Federation found a significant increase in assault towards abortion clinics, including both patient and staff. Some of these figures include a 600% increase in stalking, a 128% increase in invasions, where protesters forced their way into clinics, an 80% increase in bomb threats, a 63% increase in burglaries, and a 54% increase in vandalism, including gunshots fired through clinic windows. Even while Roe v. Wade was still intact, many found it unsafe and difficult to seek an abortion due to the hostility of the public towards abortion clinics, providers and patients who enter and exit clinics included. Since 2022, violence and abuse has only increased, with the National Abortion Federation citing a 10 times increase in stalking from 2021 to 2022. Violent threats and protesters obstructing access into clinics increased as well, especially in states such as Oregon and Washington, where abortion remains legal and mostly available. Patients seeking an abortion face a higher risk of domestic abuse as well. A PBS article by health reporter Laura Santhanam, calls it reproductive coercion, a form of abuse where the abuser exerts power over the victim by taking control of the victim's bodily autonomy. Some ways this may happen are through forcing sexual encounters, sabotaging contraceptives with or without the victim's knowledge, and restricting the victim from seeking health care. The American College of Obstetricians and Gynecologists states that 20% of women who have become pregnant have faced sexual coercion, though that number could be much higher. Due to the nature of abuse, it's not always reported, and the victims are not always able to confide in a healthcare professional or seek help. Restrictions against abortion make it even more difficult, as researchers believe the more accessible it is to terminate a pregnancy, the lower the risk of domestic abuse, both because it reduces the risk of financial insecurity by eliminating the strain of medical bills and the cost of raising a child, but also reducing the power an abuser may have in a relationship. The lack of accessibility to an abortion means that many can more easily coerce partners into staying in abusive relationships, because if they get pregnant, they have no other choice, especially in states where both parents need to provide consent before a child can be given up for adoption. This furthermore leads to infants being born into and raised in abusive households. Other laws in anti-abortion states can compound these effects, such as how Texas provides a bounty for people who sue others for terminating a pregnancy. All these measures allow abusers to continue to take control of their victims' bodily autonomy and even increase the risk of maternal mortality due to suicide. Another part of the controversy is where doctors and healthcare providers fit in. Above all, they have a duty to help and protect patients and keep them healthy. Many disagree with overturning Roe v. Wade and view it as a necessary healthcare procedure to protect a patient's physical, mental, and financial well-being. However, healthcare workers are facing immense challenges. As mentioned earlier, abortion clinics and providers regularly face bomb threats, protests, assaults, invasions, and spam calls to their offices, which has only increased since Roe v. Wade was overturned. Additionally, states such as Texas allow people to anonymously report or sue any healthcare provider that they believe has aided in performing an abortion. In some cases, this includes removing the dead fetus of a miscarriage or performing an abortion because it has a significant chance of killing both the parent and the fetus. In May of 2023, Nadine El-Boab with ABC News reported that an Indiana physician, Caitlin Bernard, was fined and reprimanded for speaking about and performing an abortion on a 10-year-old rape victim from Ohio. Attorney General Todd Rokita attempted to rescind the physician's license, which was refuted in court. While Bernard is still able to practice medicine, she faced consequences for her actions, which was speaking about an abortion. At the time, Ohio had banned abortions after 6 weeks post-fertilization, while in Indiana, abortions were allowed up to 20 weeks post-fertilization, and the child was a little over 6 weeks pregnant. The controversy in this case escalated after Dr. Bernard sued Rokita for violating physician-patient confidentiality to sue her in the first place. She argued that the case should never have been politicized. It was purely a medical issue where a child sought health care, abuse was reported, and evidence was gathered. However, her case was thrown out. This is one of many instances across the U.S. of a physician falling into legal disputes over abortions in the years since Roe v. Wade has been overturned, and it surely will not be the last. While abortion remains a complicated and controversial issue to tackle, it is not difficult to see how it is a public health issue, affecting children and victims of rape and abuse of all ages, and the mental, physical, and financial well-being of patients. Denying or restricting access has shown a clear and significant increase in abuse towards patients and providers, legal complications as the laws continue changing, and higher rates of health complications and maternal mortality. The healthcare community has an obligation to stand up for patients who are victims of the state, taking control of their bodily autonomy as people who should value upholding public health. Thank you for taking the time to hear me out on this issue today. I hope this has provided some insight as to how and why the abortion controversy is a health issue that deserves public and outward support. Please be sure to support abortion clinics and Planned Parenthoods in your area with monetary donations, support and protests, or even just signing petitions that aid their cause. There will be links in the description under this video. I thank you again for your time.